to Second Opinion, where experts speak first. Today, we are here to talk about the experts whose opinion you take almost every day. Yes, your very own Google, ChatGPT, Gemini, Grok, and others. In the digital era, the artificial intelligence has taken over the medical field, and it's not just the doctors, but with easy access, even patients are using AI very frequently. Googling their symptoms, diagnosing their illnesses with medical test reports, verifying the list of medications and tests, all of this is now a habit many of us have. While this might be easy, cost-free, quick, and reassuring, the rise of self-diagnosis via Google and AI tool has created challenges for doctors. But they also see it as a silver lining with information. Patients often arrive with preconceived notions about their symptoms, diagnosis, or treatments, leading to misinformed expectations or delayed care. This complicates consultations as doctors must address misinformation while also building trust. To discuss the same, we have with us Dr. Somasundar, Consultant Orthopedic and Spine Surgery Consultant at Kaveri Hospital, Dr. A. Ashok Kumar, Interventional Cardiologist at Rela Hospital, Dr. Arvind Santosh, Consultant Obstetrician and Gynecologist, and Dr. Raymond Dominic, Specialist Onco-Critical Care Services at Apollo Proton Cancer Center. First of all, when we discuss this topic, what actually brings patients to AI platforms? I would like to start with you, Dr. Raymond. Okay. What do you think is causing this? Is it fear? Is it some sort of anxiety? Or is it like, they want reassurances that whatever they're doing is actually right?
I think it's just the ease with which information is available to them. This is an era of information technology. Anybody has easy access. Everybody is curious. Everybody has a right to information. And, unlike previous days, internet is not a luxury, it's a necessity and you just can't live without it. And people are a lot more informed, which is a good thing. I think everything is moving in the right direction, the patients, the doctors, and the information technology. Only thing is, we need to see how to nuance it. So yeah, ease of access and the right to information.
Now that we talk about right to information, Dr. Arvind, I would like to ask you, very key component of your specialty is pregnancy. Yes. Now there is a lot of information that is available online, that's available on AI platforms. How can patients verify such information? And I would also like to know, what are the things that they actually come to you with?
Artificial intelligence in medicine is a very developing specialty. So to find data is much more easier through Google, and with AI it's much more easier to ask questions to what exactly you want from the AI machine or the software. But the issue is, when you ask the AI what you want, you need to be able to prompt it properly, and we are not very good prompt engineers. We need to be very skeptical when we ask AI about certain very important questions about healthcare, but more or less basic questions can be answered quite easily by ChatGPT or Gemini or Grok. And certain things which the patient, which is not a major complication or a major issue, like I have some heartburn, can I take this tablet or not, they can answer by ChatGPT. But that heartburn can also be to do something called as a severe preeclampsia, which is a very life-threatening condition. So at that time, it becomes a double-edged sword. We need to know how to use it. It's going to take some time, but I think it's the right direction to move forward in.
Right. You mentioned heartburn, and we have a cardiologist here with us. Dr. Ashok, I want to know, do people Google or ChatGPT heartburns, or their treatment methodologies that are discussed with them, or they're just symptoms? Sometimes it could just be some sort of gastritis that's giving you pain. But with the kind of cases we are seeing related to heart attacks and cardiac arrest, everything, it's not clear. There's no verified information. So when there is a lot of misinformation as well, how do you see it affecting the treatments?
Yes, information is available, whether it's well-informed, misinformed is a big debatable issue, especially in online platforms and the blogs that and all the YouTube sourced information, and I mean this most of these online platforms. Most of my walk-in patients do actually browse. I mean seek information. I mean there is a sense of curiosity. I mean that's a that's a core human human need actually, and thanks to this the technological advancement, the era that we are currently in, information is available, so the access is good and ease of access. I mean it is quite easily available. A chest pain in a 20-year-old could be heart attack, but very unlikely that it could be heart attack. It could more likely it could be a musculoskeletal pain. When my orthopedician sitting next to me, it's more likely a musculoskeletal pain. I mean it misses out on the context, but the more the heart attack is more catchy, so it gets actually top of the list. So it actually creates a sense of anxiety. I mean the anxiety and prevalence actually goes up the more you browse and with not connected to the context, and you make a decision out of it. That's the problem. Otherwise getting browsing, seeking information is quite good, because it actually creates it serves as a conversation starter with the physician as well.
Right. Coming to you, Dr. Somasundar, Dr. Ashok says that if you use the right way, are we having patients coming to you who are coming with the right information which they get through these platforms?
So as per the question, yes. So we get a lot of patients who come to us after Googling, ChatGPT, everything. Those only very few of them will accept that they have done this research. My perspective is good, because the patient has a right to be cared about their condition, about what they are going through, and I somehow feel it makes our job also easier in explaining to the patient about exactly what is happening to him. But the problem comes when they over anticipate and when they're over anxious, and as Dr. Reynolds has told, they are not aware about what prompts to give. If I go and tell ChatGPT that I have a back pain, what are the causes? It will start from muscle sprain, and the 10th cause will be a severe cancer. So that is how it is programmed to say. But we should not be alarmed looking at that cancer. I'm sure many of these doctors, most of the patients have come to them anxiously, worried that the cancer was there in the list.
Right.
So if we know how to deal with it, in fact, some of my best patients who I have recently, it was a pleasure for me explaining to them about the condition and about to treat them, because they are very well aware about what they are going through.
Right.
Because they've already been informed by ChatGPT.
Right, right.
So it is a double-edged sword, and we are here to make sure it works in the right way.
Right. So while it is important to use it the right way, and it can be a plus, we also see that there can be a lot of misinformation with respect to gathering information through online platforms, because again we don't have everything that is a verified information. So Mike, this question is actually common to all of you, and maybe we can start with Dr. Raymond. What is one of the misconception or the kind of misinformation that people come to you, which is like in particular to like critical care in your case, and we can go about every other specialty. What is it that you find is the most misinformed part of the information that they actually have?
The bad part of going to. So yeah, I'll just pull up a little from what has already been discussed. So somebody was just talking about fear or anxiety that arises out of this sort of a constant behavior in looking up. So that's a new term that's come up. It's called cyberchondria. Okay, you're always afraid that you have something serious, whereas you might just have something very, very frivolous. So that is one thing. And like our orthopedic surgeon just described, the causes of back pain can start from a minor musculoskeletal pain, just a low back pain, to a cancer or some problem with your aorta that it has burst. So this is going to give rise to a lot of emotional chaos. So the list of problems because of this information search or information craving starts from, it is multifaceted. Maybe people just take that information for granted and delay treatment, or treatment has been started by a doctor, they take this information and they stop continuing the treatment. or they just land up with this cyberchondria. All these tools, I mean AI or Google or whatever that you're using, they are to be seen as tools for gathering information. They cannot replace judgment. You are free to look these things up, you are free to discuss these with your doctors, but don't assume that this is better than the doctor, because the physician or the clinician is equipped with judgment capacity, which is not possible with AI or any of these other tools. And like Dr. Arvind also told you, the prompt, how you frame your question is really important. You want to look up for something and you land up finding something completely different, and you land up doing something atrocious, that's going to really mess it up. So it's all about digital literacy. So
Right. Yeah. So Dr. Arvind, what is it that patient come to you with?
Yeah, so the problem with obstetrics and gynecology is there's a lot of misinformation going around, and I would be happy if my patients use ChatGPT or Gemini to cross-check health influencers online. But I would always recommend that whatever you learn from ChatGPT or Gemini or Grok or whatever AI tool that you use, please have a consultation with your doctor. And when you have a consultation with the doctor and you have all these points noted before you, it makes a very good consultation for us also. You know what you're going to ask us, so we can be responsive, and it just makes the entire consultation much more smoother for us. And like Dr. Raymond said, judgment cannot be made as better as a doctor by AI. And the judgment will also be based on the particular disease the patient has, and in the setup is means the patient getting treatment. So AI, which is based on training from a US based healthcare system, cannot completely give a treatment protocol which is going to work in India or in that particular hospital setup. So that also has to be taken into consideration.
So Dr. Ashok, like we already said that cardiology, especially with the rise of sudden heart attacks and cardiac arrest incidents, that maybe we hear about it more now. Is it leading to some sort of an anxiety which patients come to you? Are there any consultations which would not be required, but ChatGPT has told them it could be a heart attack?
Yeah, I mean both the directions actually. Yes, I mean heart attack prevalence has gone high, and sudden deaths, especially in the younger age group, certainly is going sky high. I mean there's a paper from Registrar General of India, 30% there's an increase in the prevalence of heart attack, especially in the younger age group, between 30 to 50 years by 30%, and not just attacks, and sudden deaths from attacks also has gone up by more than 30%. Spreading this message to increase a heart health awareness, emphasizing on the necessity for change in life state to good is a necessity. But at the other end, the same information, when it is actually going overboard, it actually triggers again the same thing. I'm getting back anxiety. I mean, I got patients actually, they're not really patients, but they walk in actually in the quest of seeking seeking opinion from the cardiologist, actually assuming that they're suffering with heart attack, any discomfort happening. They may happen, may not happen. Poor sleep will also trigger a discomfort in the chest actually. Often it could be gastritis. Any intervention done is done only if it exceeds, the benefit exceeds the risk. So every intervention, be it pharmacological drug or intervention in the form of surgery, has got its benefits as well as risk and adverse events. Only if the benefits go beyond the risk, we tend to offer it to the patient, the rare adverse possible events, and that actually spreads like a viral, and that creates a problem. Somebody badly requiring attention of a healthcare provider, and they tend to get misinformed and not seek attention, and they come late, they'll end up in a problem. Especially this problem is quite high, or more likely to cost life in heart health.
Right. Orthopedics is one of the specialty wherein we also get a lot of, and spine surgery. You have a lot of emergency cases also coming in. Does these patients who are anxious to know if what ChatGPT has told them is right, now are X-rays, MRIs, CT scans being read by ChatGPTs over-diagnosing something, or is it like, okay, they're doing a fair job, but is it adding up to the the load of patients that you actually have?
It's actually a very good question, because this is what we address every day almost. So what I'm about to tell you is really useful for all the people out there, and so this is it. any person who takes an MRI, if he's at age of above 30, he will have a disc prolapse. Any patient above the age of 40, when they take a knee X-ray, they will have degenerative changes, probably suggestive of arthritis. But if you go to ChatGPT or any other AI for that matter, and if you search it, if it will say it will give you a very adverse results, and which for it might be a normal person, anyone they might not even have any symptoms. Let's assume someone is having a knee injury, and when they go and take a knee X-ray, they get degenerative changes of the knee, so they will rush up. But that is not the case. It depends on how the patient really is, and all the reports read by these engines might not be anything very significant. Of late, I'm getting a lot of patients who are reading about fatty liver. Anyone having an Indian diet for more than 5 years, they will get a fatty liver. Okay, so it is our normal. So it's when you go Google it, when you search about it, it will, even though you don't have fear about it, it will create subconsciously some anxiety within you, and until you go and sort it out, get a clarity, and make sure that the doctor says exactly what the ChatGPT says, then only we'll believe the doctor also in this instance.
So you rightly mentioned, Dr. Arvind, about the prompts. Prompt engineering is something that is still developing, and like you said, it's very important to give the right prompts, and everyday user might not be really trained in that. But when it comes to as a doctor dealing with patients who are not sure of what information do they have, what kind of strategy comes in place at that moment to actually educate these patients that this is how you do it, and what is the right information?
So I would generally not advise patients to go and put whatever you're feeling in your heart on ChatGPT and Gemini and find the answer. That's not how it works. So you need to give a clear information, like this is my age and I have this body weight, and this is what blood test I have taken, or this is what symptoms I have, and tell me what to do next, or like should I go meet, which doctor should I go and meet, which specialist should I go and meet. So that is how it should be asked. You don't get your aim as a patient should not be what is going to be my diagnosis and treatment. No, your aim is what should I do next, so that I can get better help and I know where to go seek help from. That is going to be the main issue. The second thing is, I think doctors should also learn how to use AI, because many fields have AI coming in and replacing jobs. So there are always discussion among doctors that this specialty will be replaced by AI soon. That is not how it works. So AI is going to be an integral part of healthcare in the next few years, maybe even a decade. So we need to know how to use AI to make our jobs easier and give a better quality of care.
Dr. Dominic, I want to know how are doctors using these AI platforms? Now I know AI is being used in critical care. It's being used, to have clinical and the medical practice. The integration is happening. But when you deal with patients on a daily basis, now there is a lot of research that also goes into play. So are these artificial platforms like ChatGPT, Grok, or if there are any others which we should know about, that are being used by doctors?
I think AI and such tools have become a very integral part of a physician's life, starting from very simple things like for research activities, to do a good research, to go ahead and look up at literature, to get a summary of global guidelines and evidence, which is otherwise we would go pick each one article one at a time, try to imbibe. So these things make life easier. Many hospitals have AI incorporated to their electronic medical records. If your everyday medical records have been digitalized, then the system just generates a discharge summary at the click of a button. To something more advanced, which is going to be the future of medicine, what we call as precision medicine. Okay, so this is what the medical world is going to be seeing very soon.
When we talk about the drugs, the tests, the all kind of medications that are prescribed. Now, when a patient actually verifies them with AI platforms, and you said having the right information is very important, and it becomes easier in some way. It kind of, from a patient perspective, it becomes quite reassuring that okay, I'm following the right path, I'm on the right track, my treatment is going right. So, do you think to some extent this actually helps the patients, and it also improves the patient-doctor coordination when it comes to treating any kind of ailment?
Every time we prescribe a medicine, it is normal for a patient to go and Google it and to find out, or use AI to find out what exactly it is given for. Though it is advised for you to know what medicine you're taking and why you're taking it, when you go through the searches in these results, you will find out a column called adverse effects. So if you see in this adverse effects, there will be nausea, headache, fever, abdominal discomfort. These are some of the basic adverse effects which we see in about 0.1% of the population who are consuming that medicine. So when I know if I take this tablet, I'm being a normal patient, I know this, when I take this tablet, I have a chance of getting nausea, I will start feeling nausea. It might not be, the drug might not be working, or like the nausea might not have been caused by the drug. But subconsciously, psychologically, we will feel that we are driven towards these adverse effects. It will go through a mistrust of a situation where you don't trust the medicines prescribed, and you follow your search engines, your AI more, and it's gonna take a while for you to get better in this scenario.
Right. Dr. Ashok, how do you see this situation? Also, I would just like to add, like, the healthcare in our country is affordable in certain sectors, and also in the corporates, it is seen as one bill is enough for a middle class family to make them poor. So, when you see at something at a sector which is highly pricey when it comes to like very high critical care, or treatments like cancer, which is seen as one of a very fearful disease. So when it comes to that, and patients want to be very careful about everything, like each medication that they are taking, and is everything all right. So when it goes to that, in cardiac care, how do you see that?
First question first. We are put to check actually. I see that's a good thing, because now service seekers, the patients actually has got access to information, and it serves a quality check on as well. And if they are happy, the quality check goes with AI searching and whatever. Putting the discharge summary and whatever symptoms that they experienced and with the outcome they had. Apart from the experiencing the physical improvement, it also creates a sense of psychological improvement to them if that goes actually accepted by the AI tool or the online tools, whichever it does the quality check and are offering, and that serves a rewarding on us as well. But again, contextually there could be a discrepancy. This online platforms, they only create general awareness, be relevant to the context and the personal or individual care. Coming to the cost, actually, this is one bill getting a middle class to this thing. That's not actually largely on the to keep it actually appropriate. Healthcare cost in India is much cheaper compared to many.
No, so what I actually meant with that is like, because it is something which a patient really needs, and puts in the money and the time and everything, because it's a matter of life, wherein they want to be really sure is why they are going to these platforms, and like Dr. Somasundar was saying, that they want to verify and have the kind of information that they know that okay,
fantastic, right. Exactly.
Yeah.
There should not be an apprehension that patient is actually misused of and abused of actually. I understand the context. So that's where this probably tools actually help and get them to gain confidence. But again, only problem here is the context goes missing. These tools actually provide only general information, may not be personalized, individualized.
Yeah.
Geography, I mean, may not be relevant to the geography that we
true.
practice.
Yeah.
So, I mean, they are all fed probably from the West.
From the West. A lot of references do come
and we
from there.
practice here. Our climate's different. Our socio-demographic
lifestyle is
profile is
completely
different. Our lifestyle is different. What we consume as food is different. Now, slightly our disease pattern is different. Behavior is different, and our necessity for health, health offering is different. Certainly missing. So that's where actually the trust factor. And beyond that, the forebrain affirmation, as the other doctor was mentioning, if you take a drug, you feel physically better, you start improving. The moment you start browsing on the drug, you see a rare events, you start actually start to experience that, because that's where the forebrain affirmation has actually gets disconnected.
Lastly, Dr. Dominic, I'll again come to you. How do you think a patient should do it right?
It's all about digital literacy. Yes, feel free to use it as a tool for information, but let it not judge something. Okay, you are welcome. I mean, at the end of this program, I'm sure many of the viewers would be disappointed to see that we are actually happy with you cross-checking, cross-verifying, ask us questions. It's mutually beneficial, all right? So be careful about what or where you are seeking information, okay? Anonymous forums or random blogs, don't be tricked by influencers. If you are going to seek information, make sure it is the right site, probably a government approved site or reputed hospitals or something from organizations like World Health Organization or Center for Disease Control. There are many genuine sites from where you can get reasonably good information. Information that says there is zero harm, no side effects, it's going to give you a magic cure. Always take it with a red flag, be a little skeptical. So be a little conscious of what information you are absorbing and how you are going to respond to that. I think that is most important.
Right. Thank you so much, Dr. Dominic. And I think it's a very interesting conversation that we have had here. Thank you so much for joining me on this episode of Second Opinion and for sharing your insights.